Welcome to a USC Libraries tutorial. This video is about the drug compendium UpToDate Lexidrug. It will explain how you can find and select resources in this compendium. UpToDate Lexidrug was previously known as LexiComp. It is now owned by the same company that produces the product UpToDate. These two products look similar in branding and have similar names, but are different websites made for different purposes and include different resources. UpToDate includes summaries about diagnosis, treatment, and management of disease. UpToDate Lexidrug is a drug information compendia. Make sure you start at the USC Libraries database page and search for and click UpToDate Lexidrug to access the USC Libraries licensed version of this drug compendia. UpToDate Lexidrug's interactive tools include IV compatibility, oral interactions, and identifying a physical drug. Access these via the top bar on the page. Click on one of these tools and enter the needed information to view quick results. Lexidrug's Interactions Checker allows you to enter one drug or many drugs as well as allergies, and these results are shown by ranking severe interactions to less severe, with a color-coded system to allow quick viewing. You'll see different options in other compendia's interactive tools for drug interactions. This is why some compendia are better than others for quickly and easily providing quality information to answer a specific type of drug information question. Under More Clinical Tools, view indexes to see the names of all the individual books included in this compendia. This compendia has a wide variety of monographs produced by different editorial groups. Monographs include brief information about all aspects of drugs, but each monograph makes their own choices about organization and depth. Here are the fields or categories that are included in a Lexidrug's monograph. Dosing for general and special populations, labeled and off-label uses, detailed interactions with drugs, food, and laboratory tests, significant adverse reactions, and many more. The monograph book named AHFS Essentials includes fewer fields in a different order and has different information. Dosing information only includes general information for general populations and nothing for special populations. The adverse reactions information is included in the cautions field and only covers common adverse effects instead of all reported. You will see differences in the fields and their detail in monograph books included in this compendia. Lexidrugs, Pediatric and Neonatal Lexidrugs, AHFS Essentials, AHFS DI, Lexidrug International, and Geriatric Lexidrugs. Being aware of the differences between the monograph sources in depth and number of categories, so you can select the appropriate one for each question as they arise, is a key competency in drug information knowledge. UpToDate Lexidrug also includes handbooks, a book focusing on one specific category of drug information. There is a wide variety of handbooks covering natural products. This compendia has the best natural products information of all compendia licensed at USC: pharmacogenomics, infectious diseases, patient education for several audiences, a book on toxicology, on allergy, off-label uses, pregnancy. You can see the main content of these books on this screen and can browse each monograph or handbook from this screen by clicking the name. The more common way to use UpToDate Lexidrug is to search. Search for metformin. The results show individual monograph books and handbooks with chapters that include your drug name. Click on More Results under the search to see all results from all books in this compendia. Book names are displayed above chapters, allowing you to select the most appropriate source for your question and patient. If you are performing counseling and need to explain to someone when to take metformin, these patient education results may be useful. If your question about metformin is about something well known and for a general population, what is the appropriate dose of metformin in type 2 diabetes, or what are the most common adverse effects? A general source like a monograph in Lexidrugs would be excellent. If your question is about a younger or older person, you might select a different type of monograph book. If your question is more detailed, you need to know a significant amount about managing the toxicity of metformin, or need to tell a doctor if it is safe to use metformin during pregnancy, you might prefer to use a handbook that only covers that area. UpToDate Lexidrug is commonly used in community pharmacies and hospital pharmacies because of the breadth of its tertiary resources. Understanding the differences between information provided in a single compendia and its interactive tools, monograph books, handbooks, and patient education content in order to select an appropriate source for a specific question is a goal of pharmacy education. The easiest way to understand and differentiate between the sources in UpToDate Lexidrug is to try using them to answer drug questions and compare the length, depth, and language used in the sources you find. If you have further questions on accessing or using UpToDate Lexidrug, contact the USC libraries.